So this is our case of a rare side bent ilium fixation, which I just treated. It's a pattern that's not described in the literature. And this is part of a complex case called sacroiliac instability, sacral spring test injury in a medical student. And this is Hesch Institute in Henderson, Nevada. So a while ago we showed you how the pelvis was fairly symmetrical, but there was a lack of side bending mobility in the right ilium, but normative mobility on the left. And we showed you that there was a lack of recoil, and I don't know what we're going to find here, so we shall see. So I can take up the slack, okay? I can take up the slack, and you see a little bit of a protective response in her body, and I can spring it. And when I let go, there is a little bit more of a spring. There's a definite recoil. Can you see that recoil in her body? I can see it through her whole body, and that was absent. So one more time, I take up the slack. I do see the protective response. I'm provoking some pain, and I can spring it. And when I let go, it recoils forward. So that is a different structure. It's moving differently now. Would you lie on your stomach, please? We like to document the unusual, the rare cases, and this qualifies. So there's the PSIS, so I'm coming in here, taking up the slack, and you can see now I can take up the slack with a reasonable amount of force. I can spring it, and you can see it recoil back. So now I'm going to do a drawer test, or I could walk around the table, and I can take up the slack now, and I can spring it towards me. So we've restored normative physiological motion in a side-bending direction of the ilium, both lateral and medial. It happened to be positioned laterally, if my memory serves me correct. So interesting case, and thank you.